Hi, I'm Dr. Jeff Wise, audiologist and owner of Wise Hearing Care. So Wise Hearing Care is a fully mobile audiology practice. I see patients in their own homes. So I serve a variety of larger senior communities in the North Shore area, as well as make private house calls. So that includes things like diagnostic audiologic evaluations, hearing aids, hearing aid troubleshooting, earwax removal, ear cleanings, some cochlear implant troubleshooting as well. The reason why I started my practice is because I predominantly serve older adults who may have difficulty getting to appointments, or they rely on their children or grandchildren to take them to appointments, which isn't always convenient or easy. So I bring the care to them in their own home. Much of the testing is automated, so it's automated physiologic testing, looking at every component of the auditory system from the outer ear up to the brain to see how each part is functioning. It's much more involved than some people might realize. When we talk about hearing, you have to talk about the brain because ultimately we hear with our brains. I always describe the brain as a muscle of sorts, and so just like any muscle, if you're not using it, if you're not asking it to work, its function will decline. On so many occasions, I've seen an individual who does, at least at first glance, seem to have some sort of cognitive decline or loss of cognitive function. We treat their hearing loss, and it is amazing what difference that can make, where when I first met the person, they weren't really engaging in conversation. They didn't seem to understand what was going on. After we treat the hearing loss, I'm having full-length conversations with them. They're completely reconnected with not only me, but the loved ones in the room and what's happening, and it's amazing. That's one of the reasons I love doing what I do. It's about so much more than just the gadgets in your ears, which is why it's really important to me to spend a lot of time educating individuals on what challenges they might anticipate and how best to address those challenges. Because of the way that I practice, I do get to spend a lot of time with patients, and I get to know them on a personal level. I get to know their family members. We're on a first-name basis. If they're having an issue, they know they can just reach out to me directly. A good first step is to just have your hearing tested. I've done thousands of hearing tests. Nobody's ever left in tears. It doesn't hurt. They're very straightforward. And even if you think, maybe I hear okay, it doesn't hurt to get a baseline exam, because down the road, as we age, it is typical that we will have some decline in auditory function. And it's great to have a baseline exam to be able to reference to down the road to see how much things have changed in that window of time. Hearing care is healthcare. A good starting point is to call and have a hearing test scheduled, and we can go from there.